All right, thanks, Matt. It's time for our Health Watch this morning. And as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
Now, we have some timely matters here. We recently covered the death of James Vanderbeek, and he's from Connecticut. I just learned that last week.
Oh, I didn't know that.
Yeah, me neither. But he died from colorectal cancer, and this is once again bringing those types of cancer cases in the spotlight because he was on the younger side. And is this a trend that more doctors are seeing?
It is. Let's talk about this. This is an important trend that we've been following. So let me share some good news first. So diagnosis, incidence, and death from colon cancer in age 65 and above has been steadily falling. Because of screening mechanisms, because of smoking cessation, campaigns. But what's concerning is, to your point, 50 and below, so younger adults, we're seeing more and more of a trend, more cases of colorectal cancer. In fact, since the 90s, mid-90s, there's been an increase of 1% at least, minimum 1% annually, in the rate of detection of colorectal cancer in 50 and below. So, which is very concerning. Now, you may recall that, viewers may recall that screening guidelines for colorectal cancer, colonoscopy, they've been revised. Now it's 45 years and up that you need to get a colonoscopy. There's some blood tests that can be done in lieu of a colonoscopy. But, however, what I really want viewers to understand is, please do not take any symptoms, just think you're young, it's going to go away. If you have change in bowel habits, either constipation or diarrhea, mostly towards the diarrhea side, for 3 weeks or longer, speak to your doctor. Get medical attention. If you see blood in your stool, that's never normal. Don't always attribute it to, hemorrhoids, which is probably one of the most common causes for blood in stool, but it's always good to get worked up. All of these are, so-called red flags that prompt a medical workup. If sometimes there may not be blood in stool and you may just feel tired, fatigued, and low energy. That may be signs of anemia, where there's chronic blood loss happening, which can also be because of underlying lesions in the colon. So again, get medical attention. It's really, really important. If colon cancer is detected early, the 5-year survival is almost 100%.
Awesome.
But the thing is, if it's detected late, like it was in this actor and even Chadwick Boseman a few years ago, in his 40s, stage 3, both of them were diagnosed at stage 3 colon cancer, and that progressed, and unfortunately we lost them.
Just sad stuff to hear because they are so young. We're so young, rather, and it's just better to be safe than sorry.
For sure, absolutely.
Okay. Our next topic here, a lot of folks are into health supplements, herbal supplements and things of that nature, but some new research shows they may not exactly deliver the promises that the packaging states.
Yeah, so there's a 2024 study that looked at 3,000 or so adults, and out of them, they were surveyed, and almost more than half of them said, I take supplements. So sometimes people stack supplements in the morning, evening, they're multivitamins, they're probiotics, magnesium, vitamin C, what have you. So the basic premise here is make sure you have a good, healthy diet. If you eat your fruits and vegetables, grains, dairy products, then you will get all of the nutrients that are necessary to grow and to maintain optimum body function. Now, if you're pregnant or if you have an underlying medical condition where absorption of certain vitamins may not take place, such as Crohn's disease, for instance, yes, those instances you will need additional supplementation. But because there may be some vitamin supplementation and drug interaction too. So before you start something new, or if you're already taking something, then please talk to your healthcare provider. It's always good to run that list with your doctor.
Okay. And speaking of dieting and making sure you're eating, intermittent fasting, I've seen a lot about this online, but is it as helpful as regular dieting?
Yeah, I'm glad you brought this up because this is more of a social media fad. So there's a large study review that looked at 22 different studies internationally that compared intermittent fasting, and the definitions vary, by the way, and traditional, diet to lose weight. And there's really not much of a difference. Now, the hype around intermittent fasting is not only do you lose weight, but there may be an improvement in cognitive function, it may delay aging, What's the evidence? It's flimsy at best. So this is another example of misalignment between what the scientific evidence shows and what the public perception is. Now, it may be beneficial in certain individuals, but it's not superior to any of the interventions to lose weight. There are no shortcuts to lose weight.
Okay, make sure you pay attention to that part. No shortcuts. You got to put in the work.
That's right.
All right. Thank you so much for joining us. And we have much more for you straight ahead.